I was like, well, can I change my diet? I thought actually cutting ice cream out would actually make a difference. That's how stupid I am. I worry about getting into the habit of taking pills and stuff like that. And so this interview is very timely because my primary care physician suggested me going on statins, and I have so far not done it. Although I have tons of people I know that do, and parents included. So I know it's really important stuff. So Dr. Jared Wasser from ProHealth Physicians joining us here on Bryan & Company to talk about it, and it's timely. And a lot of people out there listening have to deal with it as well. Doctor, good morning. How are you?
Good. Yeah, I'm doing great. Thanks for having me on the program.
Yeah, appreciate it. So first of all, you throw it around. Oh, I'm on statins, blah blah, blah, and people hear some of the name brands like Lipitor, but what actually is a statin? What does it do?
So, it's a great question, and hopefully we can get you on the bandwagon of people taking statins. But generally speaking, they're medications that lower your cholesterol. A lot of that comes from your diet, of course, but the liver is the main driver of that. So the statins actually work within the liver to decrease the production of cholesterol. So that's their main function.
Got it. And so someone gets a high cholesterol test or what have you, and I even did the other tests too, just to get confirmation. What are the dangers of having high cholesterol?
This is a great question too. Yeah. So in general, there are some good aspects to cholesterol, but generally speaking, the one that we want to keep as low as possible is the LDL, the low density lipoprotein cholesterol. Over time, that can deposit itself into blood vessels, both within the heart, within the brain, in different parts of the body, and puts you really at increased risk for heart disease, stroke, and a whole slew of other potentially negative consequences if that remains high.
So, okay, so I mean, basically, like both of my grandfathers died of massive heart attacks, and stuff like this helps prevent that kind of outcome, correct?
Exactly. Yep.
Yeah. And so I guess the next question I have, and we're talking to Dr. Jared Wasser from ProHealth Physicians about statins and so on, and I'm very transparent about it. I just, I have two elderly parents, and I just see all the pills that they have to take, and I'm not a Christian Scientist or anything like that. I'm just very concerned about, then there's this X side effect, so you take Y pill to offset that side effect, then Y pill has Z side effects, so you take another one to offset that. I just worry about the knock-on effects. So can you talk about actually taking it? And the two questions I have here, what are the side effects is A, and B, do you have to take them in perpetuity?
So, again, great questions. I get these a lot from my patients. As far as taking it in perpetuity, the longer you take a statin, the better it works. It's been shown, it decreases that accumulation of the cholesterol in your blood vessels, and again, decreasing that risk of stroke and heart attack. So the longer you take them, generally, the better you do. With that said, if you can make some lifestyle changes, significant ones, increase your exercise, decrease your intake of bad fats, there's always a chance you can come off of those things.
Okay, so the longer you take it, the more effective it is. And that was my next question was about, lifestyle changes. And you talked about getting rid of bad fats. What are we talking about in terms of food?
Sure. So, obviously fast foods are a big culprit. Any kind of red meats, things high in cholesterol, foods high in cholesterol, dairy products that have a high content of milk fat in them. Eggs, unfortunately, although they have some benefit, they do have a high level of cholesterol in them. So all these things factor in. So it's not to say you can't ever have any of those things ever, but certainly want to minimize them. Other things like alcohol also factor into your cholesterol levels. So keeping those at a minimum is always beneficial.
We're talking with Dr. Jared Wasser here from ProHealth Physicians on Bryan & Company. Are there any foods that don't interact well with statins when you take them?
So the main one, that always gets brought up is grapefruit juice. There are very few other foods these days, that really interact. And again, it's not all of the statins that interact. Some of the older ones tend to interact more with that. Foods-wise, no. I think generally speaking, there's not much to be concerned about there in terms of interaction. Some other medications can interact with it. So that would be something to bring up with your doctor to make sure that something you're on already isn't going to interact.
And so I have two more questions for you, doctor, and I appreciate it. One is there's a lot of different, and again, like, I don't know about doctors and whether, like, the people who make Lipitor, they work in conjunction with X Practice, and the people from I don't know, one of the other ones, Crestor, works with another doctor. Like, so there's all these different brands, and they obviously, there's a business relationship between physicians and these brands, and there even, I find a list of like more than half a dozen different statins. How do you know what's right for you and that the doctor isn't just in some business relationship and pushing one over another?
Well, I can certainly tell you I don't get any kickback for any.
No, I wasn't implying you. I'm just saying, like, in general, like, what are the qualitative differences between them? I mean, I worry about that kind of thing.
Sure. No, and that's valid. I mean, I think, in this day and age, it's hard to know, but I can say that, these drugs specifically, I feel strongly, and I know a lot of other physicians do too, that they work very well. They're really proven. Yes, they're all over the place, made by pharmaceutical companies, but they really do work. And I think, just to give you a quick anecdote, quick story, I had a patient the other day, who he's been trying very hard to bring down his cholesterol by all the means that, that we had been discussing, improving his exercise, decreasing the amount of fast food he's eating, cutting out all the carbohydrates, and really just not quite getting to where we wanted him. But we eventually put him on a statin, and his cholesterol dropped immediately. And it's very gratifying, not just for me, of course, which I do like to see that, but for the patients themselves, to really feel like they're out of the danger zone. So that's a really great aspect of these drugs.
Last question, doctor. We're talking with Dr. Jared Wasser from Pro Health Physicians here on Bryan & Company. So, for instance, say I get my physical next year and my cholesterol is still high, and then I make the decision to go on statins. Is there like a too late thing, or is it never too late?
No. So, the longer you have high cholesterol, the more likely it is that you'll develop, heart disease and stroke down the line. But it's always beneficial to go on these drugs. Even if you have evidence of disease already, it can help to stabilize that and to really, keep it from progressing and hopefully prevent any of those bad outcomes down the line. So it's never too late.
Anything I missed?
No, I mean, I think those were great questions, and I hope more people consider these drugs. And like I said, if any patients of mine are listening and they have any questions, I'm happy to answer those as well in the office. Yeah,
it's good stuff. I mean, again, like, I just followed my own. Because I'm dealing with this stuff, so it's very front of mind for me. So I appreciate the insight and the flexibility to answer a whole bunch of questions. Doc, thank you so much. Appreciate it.
Thank you very much.